Ministry of Health is delighted to take its turn today on the Minister's press briefing to share with the press what progress the Ministry has made so far within our mandate to ensure a healthy population for national development. As you may be aware, the Ministry is mandated to formulate policies, mobilize and allocate health resources, monitor and evaluate progress made towards providing access to quality and affordable health care. Between 2017 and 2023, what we have done so far. Today's briefing, ladies and gentlemen, will focus on 3 key areas, and I'll name them. 1, health policies, strategic plans, strategic partnerships in health, and legislations that we are working on. Then I'll move on to 2, human resource for health development, and we'll talk a little bit about infrastructure, health infrastructure development. The health sector policies and programs are inspired by global and national health agendas, such as the Sustainable Development Goals. Goal number 3 of ensuring good health and well-being. The African Union goal of ensuring healthy, well-nourished, and adequate levels of investment to expand access to quality healthcare services for all people, and other regional declarations. The policies are further supported by legislations and collaborative agreements geared towards strengthening the health sector institutions to deliver on our mandates and for the benefits of all people living in our country. During the period I've mentioned, or under consideration, we revised the National Health Policy to reflect the National Health Agenda, incorporating new developments and international best practices in health, and provide direction towards attainment of the SDGs. Other major policies and strategic documents developed include the following: Ghana's roadmap for attaining universal health coverage by 2030. This policy document expresses government's commitment to SDG Target 3.8, which aimed to achieve universal health coverage by 2030. It also defined universal health coverage in our own context, I call it Ghana's context, and provide strategic direction for the sector up to 2030. We also have developed the antimicrobial use and resistance policy. This policy is aimed at containing the public health threat of antimicrobial resistance, thus to limit development of resistance to antibiotics treatment. Ladies and gentlemen, the ministry is concerned about the growing phenomenon of antibiotics use in Ghana. We have more work to do in reducing the abuse and the irrational use of antibiotics in Ghana. We need to educate care seekers and the prescribers, pharmacies, and chemical shops. We also need strong regulatory enforcement and security services to enforce the law. This is a huge policy that has given Ghana's health sector a big acclaim on the global landscape, and we are in the process of implementing this policy. We have other policies such as the National Medical Oxygen Policy, National Food Safety Policy, National Policy for Non-Communicable Diseases, Health Sector Workplace HIV and AIDS Policy, the National Blood Policy, our Human Resource for Health Policy and Strategy, the Public Health Workforce Strategic Plan, the Pricing Strategy for Pharmaceuticals and other health technologies. Ladies and gentlemen, we have a strong collaboration with development partners, civil society organizations, and other non-state actors in the health sector. And this is demonstrated by regular engagements such as our health sector working group meetings, reviews, and health forums. We have signed and renewed collaborative agreements with some bilateral and non-state partners over the period. These arrangements we describe as strategic partnerships to helping us achieve universal health coverage by 2020. I'll mention a few. We have one with Sanofi. This is for diabetes management in selected diabetes centers across the country. They support us with training, medication, affordable access to medicines to treat diabetes patients. Novo Nordisk Pharmacy. This is also another global big giant in pharmaceutical products. We have an arrangement with them for holistic diabetes care and insulin security for vulnerable patients. We have entered into arrangements with Kofi, the Korean aid group, for maternal, newborn, and child health insurance policy cooperation, and biomedical engineering system strengthening. Roche, a very popular pharmaceutical company, for the fight against breast cancers and NCDs. Again, they give us medicines at affordable rates to enable health insurance prescribed for patients with that affliction. JICA is the Japan International Corporation for maternal and child health, again, primary health care and quality of care. And KNUST is an affiliation for health training institutions. They support our health training institutions, award diplomas and degree programs on their back. We have several others that we're engaging in. San Donato Group, HES AI Screening Limited, World Vision Ghana, Supreme Council for Arab and African Economy, City Cancer Challenge Foundation. These are all strategic partnerships we're collaborating with to do a lot for us. Now, I wouldn't forget to mention our old-time friends and partners, WHO, USAID, the FCDO, that used to be the DFID, which is now the Commonwealth Development Organization. There are several others that time might not have permitted me to look at, but that is how we want to achieve universal coverage, by forging into strategic partnerships to support our move. On the front of legislations in the health sector, we have successfully passed 3 bills: the National Ambulance Service, the National Blood Service, and the National Vaccine Institute bills. These have all gone through Parliament and have been enacted as laws that we are using to run these agencies within the last 6 years. There are works ongoing on 4 health bills and 8 other regulations which are at various stages of work. The Health Security Bill, the Traditional and Alternative Medicine Bill, the Assisted Reproductive Technology Bill, the Ghana Red Cross Society Bill, Mental Health Amendment Regulations 2023, the National Health Insurance Authority Regulations, Allied Health Professions Council Regulations, National Ambulance Service Regulations, Communicable Diseases Regulations, Vaccination Regulations, Quarantine Regulations, and Vector Control Regulations. These are regulations that we are teasing out of bills or laws that we have. Work is tedious a little bit, but we are working feverishly to try to see how we can complete all of these by the turn of next year. On the front of human resources for our development, health development, ladies and gentlemen, I would like to touch on human resource for health at the moment. The ministry has taken steps to improve training, recruitment, and retention of health workers in line with government priorities for the health sector. Between 2019 and 2022, a total of 107,566 nurses were trained in close to about 90 training institutions that we have, apart from the universities and other private sector institutions. We have 90, but we put all the training together to bring us to the level of 107,566 nurses and midwives. This includes 40,734 at the certificate level. That is what we call the NACNAP. 61,275 at the diploma level, and 5,557 nurses at the degree level and beyond. The ministry further provided specialist training for some of these nurses and midwives, medical doctors, and pharmacists. The ministry has employed and deployed 152,472 health professionals, the majority of whom were nurses. Despite these achievements, health worker migration remains the major challenge affecting staff retention. This has become a global phenomenon and not very unique to Ghana. We are, however, collaborating with the Minister of Labor on a migration policy in the sector to address the current and future issues. The policy will focus on the following. 1, strengthening mechanisms for production, deployment, retention, and reintegration of health workforce to meet local and global demands. Working within local and international frameworks for health workforce deployment and reintegration, and ensuring financial and brain gain from international deployment of health workforce through mutually beneficial bilateral agreements. Let's move away from health workforce to some of our other key achievements. Just last month, our Food and Drugs Authority was designated as a regional center of regulatory excellence in vaccine regulatory oversight in Africa. This achievement and recognition align with the President's agenda to make Ghana a vaccine manufacturing hub for Africa. Again, the drug laboratory of the FDA has also achieved WHO pre-qualified quality control laboratory status, and this is the first in West Africa. This ensures that test results from Ghana's FDA is accepted globally, and therefore creating the opportunities for locally manufactured medicines to be marketed on the international market. The establishment of the National Vaccine Institute is a significant advancement in the West African sub-region. This is second in West Africa and sixth in Africa. Let me use this opportunity to announce that Ghana, in collaboration with the private sector investment, are working very seriously to be establishing a bioequivalence center in our country. God willing, by the end of October, this will have been commissioned. And therefore, we can do all trials in our country for medicines and other medications that are manufactured and produced to be used in our hospitals. We have sustained the dispatch of Chinese medical teams to Ghana in a part of cooperation between the two countries, especially supporting our efforts to scale up the integration of herbal medicines in the health delivery system. As part of the national digitalization agenda for the health sector, the ministry has since 2017 been rolling out an electronic patient record system we call LEMS. The rollout includes networking for health facilities, deployment of hardware and licensed software, and training of health professionals. The following are the objectives of the electronic patient record system deployment in the health facilities: to improve patient flow and reduce patient waiting times, improved system harmonization, improved access to patient information and continuity of care, improved health insurance claims management, real-time disease surveillance, and improved IT infrastructure in all our health facilities. Ladies and gentlemen, the ministry has deployed the electronic patient record system to all teaching hospitals as I speak, all regional hospitals, all district hospitals, and currently we are undertaking the deployment to polyclinics and expected to be completed by December 2023. With our capacity of 50 deployment teams to deploy the LIMS to 55 health facilities concurrently, we are working to enroll all lower-level facilities, such as the health centers and CHIPS compounds, by December 2024. We have in the process trained 115,000 health professionals on the use of the system, and more than 14.2 million patients have been registered on the platform, with 21 million patient visits recorded so far. We are seeing the benefits of the deployment already, some of which are cost saving, the removal of manual fold printing, folder storage, and improved revenues. in the facilities. Okay, we have seen improved continuity of care, patient data portability across facilities, patient medical history for clinical decision-making. So if you are referred from one facility to the other, you don't need to carry a folder again. All your records will be seen everywhere, so far as you have the unique health ID system. And we are envisaging to link this to the national ID system as we go forward. We have also seen improved claims submission and significant reduction in NHIA claims rejection rates from 15% to less than 10%. We also have seen the support for real-time disease surveillance and early warning systems to strengthen public health emergency preparedness. Let me go forward and talk a little bit about National Health Insurance Scheme. And I wish to lay emphasis on the fact that the scheme is still in good health and will continue to finance health services in our country. For the last few months, we have seen significant improvement in claims, payments, and money is now moving from the authority to facilities that have submitted claims for their use. As of December 2022, the scheme has reached a coverage rate of 55%, translating to our 17.2 million active members. The population covered include 2.1 million indigents who were registered for free. All providers were trained on electronic claims submission, and this has improved electronic claims submission to 90% for service providers. The health insurance benefits package is generous and still provides coverage for about 95% of illnesses presenting to our health facilities. Family planning services for childhood cancers have also been included quite recently. To ensure access to services, government agents, the NHIA and the Ministry of Health are monitoring the ban on illegal co-payment. Demands on health facilities. We engage care seekers to report such demands to the NHIA for investigation and prompt actions. Now I can move on to significant, visible, tangible things within the health sector. And I call this health infrastructure projects. I would like us to put on record that the current government has invested heavily in the health sector since 2017. Aside from the ongoing Agenda 111 projects, which are at various stages of completion, and I think the Health Infrastructure Group have had an occasion to brief you, ladies and gentlemen, on where they are at the moment. The Ministry of Health has been working to complete many other projects, including the uncompleted and abandoned projects left behind by the last NDC government. Now proceed to show you the status of the various infrastructure projects in the health sector. I hope we have the slides on the infrastructure projects. But I can just go ahead. You have seen an exhibition on your platforms, and I think after this presentation, you'll have the opportunity to look at a lot of them. The 8 hospital projects by Eurojet, they invest funding of 339 million from Barclays or Absa Bank. 6 of the 8 hospitals are now fully completed and operational. The 2 that are standing, the one in Kumasi, that is Sewa Central Regional Hospital, is about 96% complete, while the one at Salaga is now around 67% complete. Phase 2 of the University of Ghana Medical Center project is completed fully, and the hospital is now fully operational. Investment in that, 40 million financing from the Bank of Hapolim of Israel. 5 polyclinic projects, that's phase 4 by Vamed Engineering, with funding of 13.5 million from UniCredit Bank, Austria. All 5 polyclinics are completed and operational. I think these are in Greater Accra region. Construction and equipping of 5 more district hospitals and 1 polyclinic project have also been completed and operational in Tolong, Sola, Bupe, Somenya, Weta, and Bamboi. These projects were again funded with 80 million Ghana cedi by Rafferson Bank and Vamed Engineering as the contractors. We have also 7 district hospital projects with integrated IT systems. 5 are fully completed, with the remaining 2, Kumawu 84% complete, Takoradi European Flat 98%, that is very close to completion. These projects were constructed by NMS Infrastructure Limited with funding of 175 from Barclays Bank PLC. The ministry also worked on construction of 6 health facilities, including 1 upgrade in Akontomra, Elubo, Bogoso, Wasadunkwa, Nsuayem, and Mpoho, with funding of around 26.3 million from ING Bank and grant from Oreo. These health facilities are all completed and operational now, and I think we need to do quickly commission all of them. We have done the commissioning for Akontomra, but the rest are now ready for our commissioning. We've also rehabilitated and retooled some aspects of Tetekwashi Memorial Hospital, Atibie, Aburi, and Chebi hospitals in the eastern region with Dutch Bank funding of 40 million euro. These have been completed, and we will soon see commissioning of these projects. We have completed the Tambole Teaching Hospital Rehabilitation Project with Netherlands ABN AMRO Bank facility. During the COVID-19 pandemic, the ministry, you're aware, received some funding from the World Bank for construction and rehabilitation of treatment and holding centers in 14 locations in Ghana. 9 out of the 14 centers are completed, while the remaining ones are nearing completion. I don't know if I can get a slide to quickly go over the treatment centers because of interest. We have 2 in Kolebu alone, the Fibers unit and the Kolebu Emergency Treatment Center. These have been completed and they are ready for use. Can move ahead. We have done 1 at Pantan. Pantan, we did 2 projects there, the Learning Center and the Pantan Treatment Center. We decided to refurbish those facilities to use as isolation centers, but because COVID is now gone, we may have to find some use temporary until another serious emergency comes back to us. Sewa, where we are putting the regional hospital, just close to it, we again put another treatment center. These are apparently isolation centers for treatment. We continue. The National Vaccine Institute, that is part of the new investments we are making into vaccine manufacturing. We can go ahead. If this is all, let me continue to mention some more. I said earlier on that 9 out of the 14 centers are completed, where the remaining ones near completion. We try to put the treatment centers across the country. So we have 1 at Zebila, the Adekulu, 1 in Volta region, 1 in Sunyani, 1 in Goso, 1 in Dodua, the Shant region, 1 is in Sewa. So we covered almost everywhere. The Western North has 1 is it Yoso or close to Yoso? So that is how we distributed some aspects of the COVID investments across the country. We also have completed 16 new chip compounds projects in selected locations across the country. Despite these, we have a number of uncompleted projects that we are seeing work in progress. They're a bit slow now because of inflows that are getting to the contractors' hands, but with time, these projects will also come to completion. The equipping of Komfanochi Maternity, completion and equipping of Komfanochi Maternity and Children's Block with funding of 38.5 million from Dutch Bank. This is about 56% complete. That was the old Komfanochi Maternity Block that was 44 years old, uncompleted. We tackled it, and we are getting close to about half complete with that project. The Bolga Regional Hospital, that has also been there for a very long time. We are now around 96% complete we left with fixing equipment, and soon that will also be commissioned. The Eastern Regional Hospital has seen significant progress, which is now close to about 56% also complete. We started Ifeanyi Hospital on the rehabilitation, and we are also constructing a new Western Regional Hospital with funding of around 190 million euro. This is just 15% complete. Other ongoing projects, Urology and Nephrology Center of Excellence at Kolebu, 55 million euro financing from Deutsche Bank and TMF Global Services Limited for district hospitals at Obuasi, Enyinem Trauma Center, and AGYEMANG Hospital projects. We have secured funding for La and Shama Hospitals projects, and work will soon recommence on these projects that we stopped, especially La. The ministry has also received approval for 400-bed maternity block for Kolebu Teaching Hospital, 5 new district hospital projects, the rehabilitation of Tema General Hospital, Nkranza, and Doma hospitals, as well as the construction of a new central medical stores for the ministry. We still have some other projects in the pipeline. Financing and renewal of the Cape Coast Teaching Hospital, including the new Accident and Emergency Center. Construction and equipping of the Greater Accra Regional Hospital, RAGE Phase 2. Retooling of selected public health facilities across the country. Accelerating TB case detection project, Phase 2. Redevelopment of Pantan Psychiatric Hospital and maternal and child health services and obstetrical emergency improvement project. Our way forward. We will continue to pursue service delivery interventions using the life course and One Health approach to achieve universal health coverage for all. We will strengthen the whole of government and whole of society approach to healthcare delivery. We will continue to build a better and efficient health system to respond to public health emergencies. And we will reposition the health workforce strategically for the completion of the Agenda 111 projects and manage the migration issues to the benefit of Ghanaians. We will continue to complete the rollout of the e-health platform to the lower health facilities in line with the government's digitalization drive and ensure improved accountability mechanisms in the sector.